All right, let's dive into something you might not expect. Pelvic floor stretches. Now, before you think this isn't for me, trust me, stick with us because this deep dive is more relevant than you might think.
Definitely.
We're going to be looking at a YouTube video by Dr. Eric Leckie, a physical therapist
Right.
who specializes in, you guessed it, pelvic floor issues.
Yeah.
And he's got 3 specific stretches that he recommends, all focused on relaxation, not strengthening.
And that's what's really fascinating here. Dr. Leckie is kind of challenging this misconception that the solution to pelvic floor problems is always strengthening. He points out that for lots of people, especially men, with bladder issues, their pelvic floor muscles are actually too tight. And strengthening them could actually make the problem worse.
Wait, so if our pelvic floor is already too tight, like doing Kegels could make things worse.
That's his point.
Wow.
It can. And it.
What kind of problems does this tightness cause?
Well, it can cause a whole host of issues, from frequent urination, bladder leaks, to constipation, pain during intercourse, and even lower back pain.
Wow.
It's all connected.
Okay.
Think of your pelvic floor muscles like a hammock that supports your bladder, bowel, and other organs.
Okay, yeah.
When that hammock is too tight, it can pull on everything and disrupt those functions.
Gotcha. So it's like, these stretches are all about loosening, lengthening those muscles, kind of like giving that hammock a good stretch to relieve the tension.
Exactly.
Okay, cool. So where do we start? What's the first stretch that Dr. Leckie recommends?
Okay, so the first one, he calls it the happy baby.
Okay.
And yes, the name is a bit silly, but it actually makes sense when you picture it. You're going to lie flat on your back, raise your feet above your head, and then reach through your knees and grab the outside of your feet.
Okay, so far so good.
Yeah.
But how far do I need to pull my feet? What if I'm not exactly Miss Flexible over here?
Yeah. No, the key here is not to force anything. Just gently pull your feet towards you until you feel a comfortable stretch in your groin, inner thighs. Remember, the goal here is to just relax and lengthen the muscles, not to push them to their limits.
Yeah.
And throughout this stretch, you just want to make sure that your back, shoulders, and head stay in contact with the floor.
So it's almost like I'm mimicking a relaxed baby lying on its back, just with a little extra stretch in the hips.
Exactly.
Gotcha. Anything else I should be aware of while I'm in this pose?
Yeah, one crucial element throughout all these stretches is your breath.
Okay.
Dr. Leckie emphasizes breathing deeply through your nose and exhaling slowly through your mouth.
Okay.
This helps to further release tension and allows you to really sink deeper into that stretch.
Deep breaths, gentle stretching, and picturing a happy baby, I can get on board with that.
It's a good visual.
How long do I hold this pose?
For this one, you're going to hold happy baby for about 30 seconds. You might feel a slight pulling sensation, but it shouldn't be painful. If it is, just ease up on the stretch a little bit.
30 seconds of happy baby bliss.
Yeah.
Noted.
Exactly.
What's the next stretch in Dr. Leckie's routine?
From happy baby, we're going to transition to a pose called the Cobra.
Okay.
Now, this one might sound a little intimidating, but again, it's all about that controlled movement and listening to your body.
Okay.
So you're going to start by lying face down on your mat with your hands positioned directly under your shoulders.
Okay, Cobra Pose. Sounds a bit more yoga studio than happy baby.
Yeah, a little bit.
What exactly am I doing here?
So think about lengthening your spine and opening up your chest. You're going to slowly push into the floor with your hands and lift your chest as far as comfortable, keeping your toes, pelvis, and thighs in contact with the floor. It's like you're mimicking the graceful arch of a cobra's hood.
Gotcha. So it's a controlled lift, not a full-on, back bend.
Exactly.
Yeah. I can handle that. What if I can't lift my chest very high?
Sure.
Any modifications for us less bendy folks?
Absolutely. Dr. Leckie suggests that if the full pose is too intense, you can bend your elbows and continue to lift your chest.
Okay.
You should still feel a stretch, but in a more accessible way. The key is to find that sweet spot where you feel the stretch without any pain.
Good to know there are modifications for different levels of flexibility.
Yeah.
I'm all about making things work for my body. So how long do I channel my inner cobra in this pose?
Just like the happy baby. You're going to hold the Cobra pose for about 30 seconds, remembering to breathe deeply and consistently throughout that stretch.
Okay. 30 seconds of Cobra, focusing on my breath and lengthening my spine.
Yes.
Got it. What's the final stretch in Dr. Leckie's pelvic floor relaxation trio?
Okay, this last one is called the Deep Hip Flexor Stretch, and it's a bit different from the first two. So you're going to start by kneeling on your mat and then take a big step forward with one leg, essentially getting into a lunge position with your back knee resting on the floor.
Okay, lunges I can do. I'm sensing there's more to it than just a regular lunge, though, right?
Right.
What's the key to making this a deep hip flexor stretch?
You're right. There is a little bit more to it. So the key here is your posture. Instead of leaning forward like you might in a typical lunge, you want to keep your torso upright and your shoulders directly over your hips. You should feel a deep stretch in the front of your thigh and the hip flexor of your back leg.
Ah, so it's all about that alignment and targeting those specific muscles. Imagine your pelvic floor like a hammock supporting your internal organs. The Cobra Pose helps lengthen and stretch that hammock, releasing tension and improving flexibility. So it's like we're stretching out the front of the hip, which in turn helps to release tension in those pelvic floor muscles.
Exactly, yeah.
Pretty clever. How long do we hold this pose?
You'll want to hold this one for 30 seconds on each side,
Okay.
really allowing yourself to sink into the stretch. And just like with the other poses, if you need to modify it to make it more comfortable, go for it. Dr. Leckie suggests gently pushing your hip forward or leaning back slightly to deepen that stretch.
All right, so we've got the happy baby, the cobra, and the deep hip flexor stretch. 3 deceptively simple moves, all aimed at relaxing the pelvic floor.
Right.
But tell me, why is it so important to focus on relaxing these muscles? What's the big deal if they're a bit tight? I mean, most people I know are told to do Kegels to strengthen their pelvic floor, not relax it.
That's a great question, and it really highlights the importance of Dr. Leckie's message. You see, the pelvic floor muscles play a much bigger role in our overall health than many people realize. They're not just about bladder control, though that's certainly a key function.
So what else are these muscles involved in?
Well, for starters, they help support your internal organs, like we were talking about with that hammock analogy.
Right.
But they're also crucial for bowel function, sexual health, and even core stability.
Wow, I didn't realize the pelvic floor was connected to so many things.
It really is. And when those muscles are chronically tight, it can throw off all those functions. Think about it. If your core isn't stable, your posture suffers and you're more prone to back pain. If your pelvic floor muscles aren't functioning optimally, it can contribute to digestive issues and even impact your sexual experience.
That makes a lot of sense.
Yeah.
So, in a way, by relaxing and stretching these muscles, we're actually taking care of our overall well-being. It's not just about preventing bladder leaks, it's about optimizing so many different aspects of our health.
Exactly. And that's where Dr. Leckie's approach really stands out. He's challenging the one-size-fits-all mentality of strengthening is always the answer. Sometimes the key is to find balance and release that tension to allow those muscles to function properly.
Yeah, I find it interesting that Dr. Leckie sees a lot of men being told to strengthen their pelvic floor when in reality, relaxation might be what they need. Is there like a societal reason for this emphasis on strengthening?
And that's a great point.
Yeah.
I think it reflects a cultural bias toward fixing things through, strength and exertion,
Yeah.
rather than understanding the body's more subtle needs.
Right.
We often associate strength with health and masculinity, which can lead to overlooking the importance of relaxation and flexibility.
It's almost like we're conditioned to think that the answer to any physical issue is to work harder or push through it,
Yeah,
But sometimes the key is actually to ease up and let go.
precisely. And that can be a real paradigm shift for a lot of people,
Yeah,
especially when it comes to a part of the body that we often don't even think about until there's a problem.
right. Speaking of problems, you mentioned that tight pelvic floor muscles can impact sexual health.
Yeah,
Can you elaborate on that a bit?
sure. For men, chronic tension in the pelvic floor can contribute to erectile dysfunction and premature ejaculation.
Okay.
For women, it can lead to pain during intercourse and difficulty achieving orgasm.
Wow. So these stretches could be beneficial for people experiencing those issues.
Potentially, yes. But it's important to remember that everyone's body is different. These stretches are a great starting point. But if you're experiencing persistent pain or discomfort, it's always a good idea to consult with a healthcare professional to get personalized advice.
Absolutely. Self-diagnosis is never a good idea, especially when it comes to something as complex as the pelvic floor. But these stretches seem like a great way for people to start exploring pelvic floor relaxation and see if it helps.
I agree. They're gentle, effective, and accessible to just about anyone. Plus, they can be a great way to simply unwind and release tension, even if you don't have any specific pelvic floor issues.
It's like a little self-care ritual for a part of your body that rarely gets any attention.
Exactly.
And the fact that it can have such far-reaching benefits for your overall well-being is pretty amazing.
Exactly. It's all about interconnectedness. When you take care of one part of your body, it often has ripple effects on other areas as well.
So to recap, we've got 3 simple yet powerful stretches: the Happy Baby, the Cobra, and the Deep Hip Flexor Stretch. We aim to do these daily, focusing on deep breathing and listening to our bodies.
Yeah.
And by doing so, we're not just relaxing those pelvic floor muscles, but potentially improving a whole range of bodily functions.
That's a great summary. And it's all about consistency. Just like with any type of exercise or stretching routine, the key is to make it a regular part of your life.
Once a day seems manageable, especially since these stretches are designed to be relaxing. But before we wrap up, there's one thing I'm still curious about. Dr. Leckie mentions that many people are unaware of their pelvic floor muscles until they experience a problem. What are some signs that our pelvic floor might need some TLC?
That's a great question. There are a few key things to pay attention to. First, any pain or discomfort in the pelvic region, whether it's during urination, bowel movements, or sexual activity, could be a sign of pelvic floor dysfunction.
So it's not just about incontinence or leaks, it's a much wider range of sensations.
Exactly. Another sign is difficulty controlling your bladder or bowels. And for men, erectile dysfunction can also be a symptom of pelvic floor issues.
Okay, so those are some of the more obvious signs. Are there any, subtle clues that we might be overlooking?
Absolutely. For example, if you find yourself constantly needing to pee, even if you don't feel like your bladder is full, that could be a sign of pelvic floor tightness.
Interesting.
Yeah.
I never would connected frequent urination with pelvic floor tension.
It's a common connection.
Ah.
And it makes sense when you think about it. If those muscles are constantly tight, they're putting pressure on your bladder,
Right.
making it feel full even when it's not.
That's amazing. I'm learning so much about a part of my body that I never really gave much thought to before. I bet our listeners are having a similar aha moment.
I hope so, because knowledge is power. And the more we understand about our bodies, the better equipped we are to take care of ourselves.
Well said. So it seems like there's a real need for more education and awareness about the pelvic floor.
Yeah.
We need to move beyond those simplistic strengthen, strengthen, strengthen messages and embrace a more nuanced approach that considers both strengthening and relaxation.
I completely agree, and that's where resources like Dr. Leckie's video come in. They provide valuable information and guidance in a clear, accessible way, empowering people to take control of their own pelvic floor health.
This has been a truly enlightening deep dive. I feel like I've learned so much about this often overlooked part of our bodies, and I have a feeling our listeners are feeling the same way. What do you say we recap those 3 life-changing stretches one last time, just to make sure they're fresh in everyone's minds?
Sounds like a plan. Let's do it.
Okay, so let's refresh those stretches one more time.
Okay.
First up, we have the Happy Baby.
Right. So for this one, you're lying on your back, feet up in the air, grab the outsides of your feet, and gently pull them towards you. You should feel that stretch in your groin, inner thighs. Remember to keep your back flat on the floor and hold the pose for a good 30 seconds.
Got it. And then we move on to the Cobra Pose.
Yes. So for Cobra, you're going to lie on your stomach with your hands positioned under your shoulders. From there, you slowly lift your chest, keeping your toes, pelvis, and thighs pressed against the floor.
It's like you're arching your back like a cobra. Hold this one for 30 seconds as well. And remember to breathe deeply.
30 seconds. Okay. And finally, we have the Deep Hip Flexor Stretch.
Right. For this stretch, you're going to start by kneeling and then take a big step forward with one leg, ending up in that lunge position with your back knee on the floor. The key here is to keep your torso upright, no leaning forward. You should feel the stretch in the front of your hip and thigh and hold it for 30 seconds on each side.
Perfect. There you have it. 3 simple yet effective stretches that you can incorporate into your daily routine to help relax your pelvic floor. And remember, if you're experiencing any persistent pain or discomfort, it's always best to consult with a healthcare professional for personalized advice.
Absolutely. These stretches are a great starting point, but it's important to listen to your body and seek professional guidance when needed.
This has been such an eye-opening deep dive for me. I had no idea how crucial the pelvic floor is for overall well-being and how much tension we tend to hold in that area. Yeah, it's definitely an often overlooked part of the body. But hopefully through this deep dive, we've helped shed some light on the importance of pelvic floor relaxation and how these simple stretches can make a big difference.
Absolutely. Now, before we let our listeners go, I want to leave them with a thought. We've talked a lot about the physical benefits of these stretches, but I'm curious about the potential mental and emotional benefits as well. Do you think there's a connection between, relaxing the pelvic floor and reducing stress or anxiety?
That's a fascinating question, and I think there's definitely a connection. When we're stressed or anxious, we tend to hold tension in our bodies, and the pelvic floor is no exception. By consciously relaxing those muscles, we might be able to signal to our nervous system that it's safe to let go and unwind.
It makes sense. It's like a physical manifestation of letting go of stress, and in turn, that physical release could have positive ripple effects on our mental and emotional state.
Exactly. It's all interconnected, and I think it speaks to the importance of tuning into our bodies and exploring different practices that help us feel grounded and at ease.
Well said. It seems like there's a lot more to discover about the pelvic floor and its connection to our overall well-being. This deep dive has definitely sparked my curiosity, and I'm excited to continue exploring this topic.
Me too. It's a reminder that there's always more to learn about our amazing bodies and how to care for them in holistic ways.
Absolutely. And on that note, we'll wrap up this deep dive. Thanks for joining us. We hope you learned something new and feel inspired to give these pelvic floor stretches a try.
Yes, remember to listen to your body, be patient with yourself, and enjoy the journey of discovering what works best for you.
Until next time, keep exploring, keep learning, and keep diving deep.